Hi folks, and welcome back to our series of guides on how we use HealthOne in Bayview Family Practice. I'm John Garvey, and in this video I'm going to show you the essence of the patient file. So for the purpose of presenting this information, I've created a patient called YouTube test. I've given it a kind of a crazy date of birth, so a male patient, 125 years of age. The top left section of the patient's file shows different tabs, and you can toggle through these. So you can look at repeated drugs, currently empty, allergies. You can look at trends, which is useful to get a Q risk 3 score on the patient. You can look at the lab requests, which actually in baby family practice we don't tend to use at present, though this may change. You can look at messages in relation to this patient and any referrals. Okay, so let's come back and leave it at vaccination for the moment. This is the list of transactions relating to what's happened with this patient, and at this moment there's really nothing in here, as this is largely a new patient file. So the first thing we're going to do is add some information. We want a background summary file. So it's called a basis medical transaction, but it's basically a summary page. So when you open this up, this is the information that populates, and we use the model of medical history, surgical history. Other practices using HealthOne will use problem lists. So for the moment, let's put in a medical condition, and let's say that this is a patient with a heart attack. So I can come to cardiac history. I can look at myocardial infarction, insert that there. That's a list that I've created. I can come to the blue book here. And we prefer if you use coded items. Now, what that simply means is rather than simply typing in here MI. The problem with using something like MI is that's not specifically searchable. People may use different variants of that. So, excuse my spelling, etc. But if it's a coded item, it can always be found. So go to the blue book, start typing in here, and we have myocardial infarction. Double click, and you'll know it's coded because the item appears in blue, and also there is an ICD-10 code below. Okay. Next thing we need to do is bear in mind certain items. This may be a private patient, although this information isn't listed here. But if this was a GMS patient, we'd be performing CDM reviews on this patient. So not only is this the correctly coded, but it must be given a start date because the CDM will look for that. So let's say this happened way back in 12th of September 1998. And you'll see the start date appears here. You can add more information as you wish. This is a list of vaccinations that the patient has had, and by definition in our practice this starts with the vaccination schedule for 2024 for infants. You can always remove this if it doesn't apply to your patient, so just simply select all, right click and delete. Okay. Other history that can be put down here, tobacco consumption, alcohol consumption. I often find it's very useful when you enter information here to give ex-smoker since 2019. An alternative is you can say never, but it's handy to date that, so that people know when that information was recorded. Okay. Another way that you can enter smoking history is with the smoking tab here, and that's useful to put that in, especially if they were an ex-smoker, to work out the number of pack years that they've smoked for. Okay, so we now have our background information on the patient. We have the summary page, and so we haven't listed as yet any medications. That's through the prescription button here. So if you press this, it'll open up prescriptions. And for example, now I can just say, okay, patient is going to be on some aspirin. given their heart disease, probably on some ramipril, probably on a atorvastatin, high dose, and perhaps even a beta blocker. Okay, so these are repeat items, and as we prescribe them, they come below, but you'll see that when we discuss the prescription module in a separate video. Okay, the next thing here that you want to know about is the transaction button. So this is where you add new transactions. You can click on the main button here and it will give you the options here. Or if you click on the little arrow at the side, it shows you, or the down arrow, it will show you the most commonly used items. So for example, we may wish to add a consultation note. So click here, and straight away in my version of HealthOne, this populates with a SOAP list of items for me to fill out for a consultation. In a lot of versions of HealthOne, even within Bayview Family Practice, this will be empty. So you will open up a consultation, this will be blank, and you have to add a SOAP analysis if you want. So come to the sequence list here, click, and then decide on what you want to add. In which case I want to add a SOAP consultation, and that then appears, and I can now start writing down information. One of the handy things to know about is patients will often give you several items to consider, several items to review. And if you start to list them 1, 2, 3, you'll find that this can become very crowded and difficult to read. So one of the handy things to know about in HealthOne is that if you want to start on a new line, simply press Control and hit the Enter bar, and now you can item 1, cough, 2, blood pressure, 3, yeah, headache. Okay. If you wish to add items, for example, if you click on blood pressure, you're going to check blood pressure 120/78. You might want to now record the patient's weight, but you notice the item weight isn't here. If you simply, at any point, without opening the item, so if I have this item open and I type weight, that will appear. But if that item is closed, such as now, and I type weight, it will look for the item weight. And when I double click on that, now I'm in the right panel to enter weight data. Okay. So other things to know are we also have consultations by telephone. We will create drug prescriptions. We'll decide we're going to send those drugs. And the prescription is there. We will also see things called expert reports. And this is basically usually a hospital letter, or might be a prescription that's been sent into the practice, or some other information, usually from a consultant or secondary tertiary care. One of the little secrets to HealthOne is that we use the comments section quite a lot in Bayview Family Practice. So you can right click here, select attributes, and you can add a comment. So you can go ENT OPD. And you'll see now that this appears here. So it can just make it a little bit easier when there are several more consultation notes present. And you're wondering, where was that ENT report, expert report, ENT? You could also add the note for consultation to say attributes, PMA for AXA. So again, that makes life a little bit easier there. Okay, some of the things in HealthOne that make life very, very easy. Let's go to a consultation, and we have one that's not so blank there, but we'll create a new consultation. Okay. Now say I want to perform a CDM review on this patient. I can come to my Mediforms. Now, Mediforms are like having little widgets or little apps within HealthOne, and they're absolutely fantastic, and we can design our own. So if I want, for example, to perform a CDM review on this patient, I simply click CDM. So what has happened here is it's in this section, it's checked the PPS number. It's found that the PPS number that I've entered is unreal, so it's not allowing me to open that. But if it was real, you could. So these are other examples of there's driving license, medical, and you simply fill in the information. So you could just say you're looking to give it for 3 years, and just click in information here. So no. I'm just literally ticking things randomly. And you see how the information is saved. Now it's saved as items here, but if you click on any of the items that were part of that Mediform, it opens the Mediform once more. So you'll see the information saved that way as also. So that is Mediforms. Another very useful function to HealthOne is that you have a vaccine button, which is specifically used for quickly adding COVID vaccines, influenza vaccines, or pneumococcal vaccines. And what happens is the HSE will populate the most recent codes, etc., into this. So you can, if you select Pfizer, it'll give you the most recent Pfizer codes, etc., in terms of lot numbers and expiry dates, etc. If you want to perform an STC on a GMS patient, you will claim for that. And ways of doing that are you can go into Tools, copy the GMS number or PPS for some STC claims. And if you then go to STC claim, and I show you this window, it will now allow me to open this, and I'm in and I can simply log in and make the claim. Once I've made the claim, I can insert the ST claim under billing. This is the billing tab. And so, for example, I can say cryotherapy, and I would put the claim number here. Okay. Other useful tabs are, this is the button to create a social welfare cert. So if you click on this, you must notify that the patient has given consent for this to be done. So you will mark that down. You will put in the relevant incapacity. So you say convalescence following surgery. Okay, for example, double click on this. You say the dates that you want off, so you can give a specific date, or you can in fact say that you want it to be for 10 weeks. And then you click submit, and then it will give you the option to send that, but it will double check the PPS number as well. So in this case, it's going to bounce back to me. If for some reason you are working in the practice as a locum and you don't have your own contract with the Department of Social Work, then you need to simply select a doctor here. So it gives you options here for different panel holders that you can use, and you just select one of the other panel holders in the practice and use their Department of Social Protection number to create the claim. Okay. Just to show you as well, you have the option here to send a text message to the patient. Although you send the text messages from this button, this will show text messages that have already been sent. And we don't use action plans so much, although I would say that our nurses do. This is the window from which you can send a message, but they're the main uses of the patient healthcare file and how you save information. Okay, thank you very much for watching.